Hi, welcome to Candid Chats on Cancer. I'm Mary Robinson.
I'm Jamie Moore. Mary, who are we talking to today?
We are talking to Dr. Ternent. It's great to have you on the show today. Can you tell us a little bit about you and where you're from?
Yeah, it's great to be here. Thanks for having me. I'm a colorectal surgeon here in town in Omaha, and I'm originally from Florida. That's where my parents were, where I was born, and we moved around, and I ended up coming to school here at Creighton University, and that's where I did my medical school. And then after that, I did my general surgery training in upstate New York, and then we then moved back and did my fellowship here, and then we liked it so much we've been here ever since.
You stay. Okay. My first question is,
Okay.
why from Florida to the Midwest? Besides, Creighton is one of the best medical schools in the United States. There's no doubt about it. But
So why?
Why come to the Midwest?
Yeah, so my mother, as we were growing up, she had friends she grew up with that had gone to Creighton and neighbors that had gone to Creighton. So in the end, it was like, yeah, I'll check it out. And it was really for us, it was good. So I'm very glad I came here.
Oh yeah, and you knew people, so that helped. Yeah. And of course, people in the Midwest are amazing.
Yep, for sure.
Yep.
Very true.
Well, I'm glad you stayed.
Yeah.
Oh, thank you.
Because Dr. Ternent was my GI surgeon, or is my GI surgeon. He's my gastroenterologist. We got to meet one day after a colonostomy. Or no, you gave me a colonostomy. And then we just been friends since. Remember we met him last week on the Boxer.
That was great. The Boxer 500.
That was a great race.
That was one of the greatest things ever. And for me, I have to admit that that day was a great day for me for multiple reasons. The people that were out there that were supporting colon cancer we just met some just cool people. But the thing that impressed me the most was I had my back turned to you, and you came up and tapped me on the shoulder to say hi. That couldn't have meant more to me than anything in the world. That was just the coolest thing ever.
It really was neat.
You know.
Yeah.
And then then we ended up pinning you and asking you for an interview.
That was funny.
But yeah, you didn't expect that when you tapped me on the
Did
shoulder.
not.
But I have to admit, from my heart, that was one of the most beautiful things and the most humanistic things that a doctor could have ever done. Yeah.
Oh, it's my pleasure. I mean, you're a great patient, and yeah, I think that race, the Boxer 500, is just something. It's just a good thing, supporting the community, supporting cancer patients and the families.
Yes.
So it's just a good
neat to
support.
see a doctor there.
Oh yeah,
You know?
we love go there every year if we can, and yeah, I mean it's good exercise and it's good for. I mean, it's good to see the patients, see everybody. Most of them are friends, so it's just it's a good support, and it's just for a good cause, right? So it's something the American Cancer Society puts on, that it's just good. So it's good to support it, and it's grown over the years, right?
Yeah.
So try to make it every year if I can, for sure.
Well, we're going to make it every year now for many more years to come.
Yeah, the pancakes were the best.
That's the
I'll
best.
have to say that.
God,
I
those
agree
were
with that.
good.
Yeah.
Yeah.
So what got you interested in being the doctor of your...
So everybody asks me that, kind of, so why did you go into colorectal surgery? And really, kind of, as part of the training, you know, kind of when you're a medical student, you get exposed to it, and it's not for everybody, but I always thought it was something that I was interested in. As a colorectal surgeons, we get to do big operations for cancer, for inflammatory bowel disease. So not everything cancer, but a lot of it is. So you have variety, and at the same time, you can do smaller surgeries and colonoscopies at the same time. So it's a gamut. It's kind of concentrated in one particular area, but at the same time very in-depth. And you get to do things that are very specialized that maybe not everybody can necessarily do. So by doing a few things well, you I think it kind of helps kind of your outcomes and improve the outcomes of patients too. So it's been, so that's how then I went into general surgery, and then just from there decided that it was definitely the specialty I wanted to specialize in. So.
Well, you do an amazing job, because I know Jamie, he said that you saved his life.
Yeah. There's no doubt about it.
Yeah.
I mean, well, your hands and your brain was, you know, did a remarkable job, and your team that you had with you in the OR, and the team that took care of me afterwards. Your fellow was, oh yeah, that poor guy. I only had control over one thing, and that was the fellow. I took it, and he was the only one I could really control, and he was just the most beautiful person too that helped me out. But I think what was one of the most remarkable things was, for me anyway, was looking forward to seeing you every morning. And there was some nights that, you know, there was some worry whether I'd make it, you know, through the night to see the next morning. But I always knew that in the morning, around 6 o'clock, you show up at my door, and you always came in and you went, you had a big smile on his face, and you always give me this big thumbs up. And I was sitting there always, you know, being an old nurse, I'm sitting there going, okay, is he giving me the thumbs up because he's just like the greatest doctor in the world, has the greatest bedside manner ever, or is he just giving me the thumbs up because he's going, dude, you're still on my on my list today?
It's like, what a miracle. Yeah, I mean, no, I agree. I mean, it's great to see the progress, you know, but the main thing is, like you're saying, it's a team effort, right? I mean, I can do the surgery, but it takes the patient to recover, the patient to go through it, and so my approach is, through the years, is just to make sure that we're in the same team. Everybody needs to know what we're up against, and if we do that and everybody's on the same boat, it's the best possible scenario.
Yeah.
And good family, good patient, you know, and then a good team and a good place to do everything. It's just a perfect combination then to attack whatever is it that we have to do.
And that brings up another point. You know, colons, people are kind of scared, I think, to get a colonoscopy. And I don't know if it's because of the drink. I don't know if it's because that's a body part that they don't like people messing with necessarily. But I guess what I want to know is, when should a person get a colon screening? At what age? Can you give us some insight on that?
Yeah, that's a great question. I mean, one of the key things we can do to control our future is, we know that screening for colon cancer, like from some of the other cancers that are common, screening becomes important because it's so common that you can do tests to minimize the risk of getting it. And colon cancer is one of those, because we know that the cancers usually start in polyps, and we know that if you can find the polyp and remove it, you may intervene and prevent it from progressing to being a cancer. So that's where screening options come in, and now they've moved the age from 50 years to start screening for colon cancer to 45 years, because we're finding cancer at earlier and earlier ages recently. So the American Cancer Society and the powers that be kind of got together and decided, we're going to move this down to 45, and that means now you can start getting your colonoscopies at age 45 instead of having to wait to 50. And that's just screening. That means no symptoms, no significant family history. For patients and people that have a strong family history, you may need to start 10 years or more before the earliest colorectal cancer in your family, because the closer it is to us in our family and the younger the age, the more the risk that we're at. So those are guidelines. You don't have to wait to 45 if you have symptoms. If you're having rectal bleeding or symptoms that cannot be explained from a GI standpoint, anemia or something like that, then you don't have to wait to 45. You start earlier, because sometimes it presents in 20-year-olds, teenagers, 20s. The younger we are, the more rare it is to get colorectal cancer, but it can still happen. So if there's symptoms, you should have it checked out. Even without symptoms, at the latest at age 45.
So in other words, like for me, for my sons then, since I got cancer at 58, they need to get screened, what, 35?
Well,
Would
so
be a better?
10 to 15 years before the earliest, and at the very latest at 45,
Okay.
if they don't have any symptoms. But, and then, yeah, with a family history, you might go every 5 years instead of waiting 10 years before scopes. And then the main thing is, where people are talking about, oh, it's horrible to take the PrEP. The PrEPs, they're still not great, but they're getting better.
Right.
So nowadays you can take lower volume PrEPs that get you cleaned out without having necessarily to take the gallon for most people. And most of the times, most people want to get a little bit of anesthesia, so you take a nap and when you wake up, it's done.
Right.
So really, it's more the thought of it, and the preparation is not as it's not great, but it's a lot better than it used to be. So,
I remember when I had to have one, I called my doctor and I'm like, do I have to drink all this? I'm almost bawling because it was so yucky. And she said, yes.
yeah.
Yeah,
You have to drink it.
Yeah, you have to drink all of it.
Yeah.
That was kind of the sad thing for me was, most of my career I'd made 80-year-old ladies have to drink it because I would get in trouble if, this, whoever was doing the colonoscopy sends them back up to me and says, okay, well, they're not clean and we couldn't see anything. Well, guess who gets in trouble? Well, the nurse. Well, this poor little 80-year-old lady is like, you gotta drink it all, please. Don't get me in trouble, all right?
And you think there'd be something else they could do instead.
Well, that shows you how old of a nurse I am. I mean, we were doing that stuff to back in the day. But even then, they'd send them up and we have to do enemas till clear. So they could go in and see. One of the problems with my last scoping was because of having my two appliances, I can't get all the way clean. And so it makes, it's like putting a microscope in the Missouri River, basically. Maybe
So
not
what do you
quite
do
that
for
bad.
that?
So sometimes that's the best you can do as far as you try and irrigate and clean things out. But yeah, certainly in most people, 99.9% of the times you can get cleaned out, and then you want to try and do as good a job and read the instructions. When you can't, then you have to just irrigate and kind of look best you can.
The best thing is just follow your advice, right?
Pretty much.
Exactly.
Do what you're told.
Yeah.
I mean, it's not fun, but it's the best thing to do things. And the scoping, yeah, I mean, I get put to sleep every time. They just basically go hi, and then I wake up and
All done.
it's all done. My wife's, she gets a colonoscopy done very frequently. Hers takes all of about 3 minutes because one, she's very good at doing her prep. She just follows it right to the line of instruction. And she starts to prepare her diet like about 4 or 5 days ahead of time.
That's smart.
That makes a big difference too. Follow the instructions and then go into like a low residue type diet before, so you don't have a lot of residue and to get cleaned out.
So what's a low residue diet? What would you
Just avoid anything with seeds, raw vegetables, or fresh fruits maybe for 7 to 10 days before at least.
So what's a food we could eat 2 or 3 days prior to taking that we could, that's healthy for us and also will give you a nice clean field?
Yeah, right before the colonoscopy, I would probably avoid fresh fruits and vegetables and anything with seeds for sure, because sometimes those are hard to get flushed out and cleaned out. So just basically just a bland diet, kind of
Soups, maybe.
soups and anything that doesn't have a lot of fiber,
Yeah.
which is basically anything meat, can have it, and just nothing with a lot of roughage, just as you're preparing for your colonoscopy.
Cool. Yeah, that's what Jen does. She takes out all the roughage, meats, and then I think like 2 days before she'll start going on like soups, and then the day before she goes on a clear liquid. Yeah, she's like,
Because she doesn't want to do it again, right?
Yeah, no, and
Yeah.
she's like a doctor's dream, But her mother passed away from colon cancer. And so that was enough for her to make sure she gets early screening to make sure, well, now her husband's, was an idiot. And I'll fully admit to everybody that I didn't get early screening. And I had 1,000 different reasons on why. I'm too busy. There's no history of colon cancer in my family. I don't eat red meats. I'm from California. I eat fruits and vegetables and good,
Fish and
fish and white meats.
lobster. I've eaten at his house.
Yeah, and so like and being a nurse, I could easily just say, no, I don't have colon cancer. And I had all the symptoms you said. The first symptom I actually had was rectal bleeding. And I was working with a physician at the time, and it was just suggested that I had probably some hemorrhoids. Okay, well, in the back of my mind, I went, I should probably have this checked out. But in the front of my mind, I went, hey, it's just hemorrhoids. And that was, 3 years later, I get to be ruining his Christmas.
Yeah.
So early screening, I can't even tell. And I'm right now, I've got a doctor friend of mine who's 65 years old who still hasn't been screened. And so I pulled up my shirt, said, here, this is what happens when you don't get an early screening. And he had all the same excuses I had. I'm too busy, the office, when I get done with that, I can't take time off. So, you know, the more you put it off, the more it is. And like, we met that guy, what was it, that had the 4 kids or 3 kids. His colon cancer was found at stage 1. They did the surgery on him, and he's got beautiful children and a beautiful wife.
Yeah, some of the advantages of screening is that perhaps you say, well, if you find it, you're going to find it earlier, hopefully. And hopefully is that you can prevent it by finding the polyp and just removing it. And
Now, are there signs or anything with polyps? Or is it something like as you're checking, you find them? Or is there bleeding?
So with polyps, when they're small, they probably usually tend to not bleed or cause symptoms. As they get bigger, then they start having more chance of bleeding or causing that kind of problem. But the problem is you may not necessarily have symptoms until it's too late. So that's why the screening comes into place when you get tested before you even have symptoms, to try and be preemptive. And there's other methods besides the colonoscopy. I mean, there's the Cologuard, where they're testing for DNA material from tumors, cells that are getting shed into the stool that get tested for genes that you can test microscopically for, and it's another way of screening. You can do the hemocold testing, that's another way of testing. So you don't have to necessarily do a colonoscopy, but it's probably your most sensitive and specific test that we have right now. But it depends what people want.
You know, I want to bring up something that we were talking about earlier. You're a cancer survivor.
Yes, I am. Yeah.
Tell us a little bit about it. What kind of cancer did you have? When did you find it? How did you find it? Did you do the same thing I did?
Yeah, well, it's always kind of different when you're like all of a sudden like, oh, there's something not right, right? And you're like, you know it's not right, but I had thyroid cancer, and it doesn't run in my family or anything like that. And but you found a node in my neck one day, and I thought it was just going to go away, but it didn't. And then one day, kind of my nose started bleeding. We were talking about it, and it was like, whoa, this is not right. And fortunately, the nosebleed didn't have anything to do with it. But after a few weeks of that being there, I had it checked out, and they're like, yeah, it definitely need to be biopsied. And it was thyroid cancer that was in 2 nodes in my neck. So I had to go through surgery. So they opened my neck and took out my thyroid and my lymph nodes from that right side of the neck. And I mean, luckily I had great doctors that kind of were like on top of things, and you know how then you have to go through the surgery, which is not always easy to recover, but you know, you kind of recover and had good surgery. And then with this kind of cancer, they give you some iodine that's radioactive that you can take by mouth because it's very targeted therapy. It gets absorbed by any tumor cells that may be there. So it was a stage 3 thyroid cancer, but it's been 6 years now. And
good for you.
Yeah, it's awesome. Thank you. Yeah. So now just yearly checkups now, pretty much. So keep our fingers crossed, right? Because you always once you've had cancer, you always have to. So I tell my patients, you always have to be on the lookout from now on, right? And it's kind of part of now the surveillance is the important part,
Right.
so that in case it comes back, hopefully you can still catch it early and then treat it.
So you were like right in the middle of your practice and everything when you got sick.
Yeah. I've been 20 years into my practice, but luckily I had good partners, good family, good doctors, and then you just say, well, got to do it. Well, what else are you going to do, right? And it was good.
It's always nice to know the surgical team when because you know who's the best of the best.
Yeah, well, it's still not good to be on the other side, but you know what? It's good to have people that can do that for you when you need them, right?
Well,
So
how do you do your screenings? I was kind of wondering how you check the thyroid or...
So for the thyroid, the thyroid is now gone, so they can palpate. This type of cancer is a papillary thyroid cancer. They can follow a tumor marker. So you get blood work checked now once a year to make sure it's like a marker that you can use for see if it starts going up, then you start getting worried that maybe it's coming back. And then they can do ultrasounds in your neck and palpate your neck, so you always keep an eye on things. Cool. So there's ways.
Yeah.
So tell us about your support system.
So
how did you make it through?
Yeah, well, very lucky. I have a wife and 5 children.
5.
Wow.
Yeah.
He has more than me.
Yeah.
I didn't think that was possible.
I know.
Yeah.
I have 4.
Nice. Yeah. So 4 girls and 1 boy, and yeah, they're awesome. So that's our pastime is, the family and the kids pretty much, and it's great, right? They're fun. It's challenging, but it's awesome. So it's
So
really,
how old are your kids?
So the youngest one is 13, and then he has 4 older sisters.
Oh, geez.
Yeah.
Wow.
Well, at least he was the youngest.
Oh yeah.
I was the oldest and had 4 sisters.
No way. Nice.
So tell him I know how he feels.
Yeah. That's funny.
So how do you decompress in the evenings from the demands of your job?
So usually I like to run. So for
You can
me-
only imagine that. He was at the Boxer 500.
Yeah.
Right. So
He didn't take the shortcut like we did.
yeah, that's all right. Yeah. So running is good, and then not just running, but then running the kids around. So between those 2 runnings, I think it's like a full-time job.
Exactly.
Yeah.
Yeah.
So it's good though. Yeah.
I've always heard that running, I'm not a runner myself, but I heard it does alleviate stress. I'd rather walk really fast and call it good.
Yeah. Walking is great too.
Yeah.
It's very
Yeah.
good exercise.
I finally last night beat my record. I'm now down to my pace is an 11-minute mile.
Oh, that's good.
That's awesome.
But I started out like at a 27-minute mile.
Yeah.
So I'm slowly getting them up there now. It's kind of fun.
Yeah.
And it's fun to set goals now. And it used to be, God, if I made it around the block, I was doing well. Now, last night it was 3 miles and I did it in 34 minutes.
It's nice.
Wow.
So,
That's great.
and it was the only reason I even started exercising was the Boxer 500.
Right.
Because we're both of us are recovering, and so we just sometimes once we recovered, as you found out, what happened after you recovered, you probably had to go straight back to work.
Yeah. I had to ease back into work. I mean, of course, you find that things you could do before, it takes longer. Like you said, it takes time to get back into. But the human body, I mean, it's pretty amazing, really.
It's resilient.
And yeah, that with support, then you can get through. Which,
Yeah, support is the best, man. I don't know how any of us could get it through at all. So it's kind of wrapping things up. What were some last words of wisdom as a survivor and as a physician that you would like to impart upon us?
So I think the main thing that first is like, this is a preventable cancer. When you're talking about colorectal cancer, there are things you can do to prevent it, and screening is your main thing. If there's one thing you're going to do, besides eating like a low-fat diet and high-fiber diet and just the things that we should normally do, that alone is not enough. Like I have had patients all the time, well, I'm a vegetarian, I run, I do this, I don't smoke, why would I need, because anybody can get colon cancer. If you can do one thing, screening is the main thing. So get a colonoscopy or some sort of screening method, better than no screening at all. And it's available, and it's the right thing to do, and that's preventable. And that if you do get it, that this is a curable and treatable disease most of the time, so that it's something that can be fought and come on top of surviving.
So how about as a survivor? What would you, as a survivor, what's some wisdom you can give the rest of us that are battling cancer still?
Just stay positive and help other people that are battling through the same, right? Because you have the experience, and then just so everybody realizes that it's doable.
I think that's half the battle too, is the positive attitude.
It really
I really
is.
do.
Yeah.
Yeah.
It's if you don't have a positive attitude, well, you're not going to be able to ever make it up the mountain.
And have positive people surrounding
Yeah.
you,
Yes.
which is, of course, your support system.
Yeah.
Yeah, takes
Yeah.
a team.
Yeah,
so.
it does.
Dr. Nett, thank you ever so much for being with us
No,
today.
thanks for having me.
We-
Yeah, it's
Yeah,
been great.
thank
Yeah.
you. It's
And
nice
thank
to
you for
meet you
being
again.
Same here.
for being my physician.
Hey, you're welcome. Thanks for being my patient. Yeah.
Because of you and your team, we get to have this show.
So just since I'm curious, are you guys, do you have to see him once a year, or do you see another doctor? Or, I mean,
I see, every 4 months I see him.
Yeah.
And then I'll have another probably colonoscopy soon, whenever he wants. And mine's easy now. I don't have to take the prep anymore. But we're waiting for everything to kind of get back and nice and healthy. So yeah, I have to see you about every 4 months.
Okay.
Nice little checkup, and we check my colostomy and my other ostomy on my left side. It's pleasant, actually. His office is just really sweet. It's a
That's
nice
great.
office. I can't, yeah. So thank you ever
Thank
so
you.
much.
You're welcome. No, thanks, guys. Thank you.
And
Appreciate
hopefully
it.
everybody joins us next time.
Yeah. Thank you, everybody, for joining us, and we'll see you next week.